Michael P. Coleman. I'm content director for Brother Be Well. And I'd like to welcome you to this particular broadcast. We're going to be talking about two things that I didn't always know were linked, chronic pain and mental health. And we've got two experts to help us explore this topic. First up, we're joined by, and help me welcome him, Kristen Jacobs, marriage and family therapist. Kristen, how you doing today? Welcome to Brother Be Well.
Good afternoon. How are you? Thanks for having me.
I'm fantastic. It's funny how I stumbled on your first name. It's as if we're just meeting. I don't know what that was about. Christian, but we're into it now. Kristen Jacobs, marriage and family therapist. And we've also got Carter Todd. He's a registered nurse, and he's the president of the Capital City Black Nurses Association. What's up, Carter? How you doing?
What's up, Michael? Always a pleasure.
Always a pleasure to be with you too. Let's jump right into this. We got just a little bit of time, not nearly as much time as we need. So let's get into this. And let's first differentiate between pain, acute pain, and chronic pain. So y'all can let me know if I've got it right. I think you get a paper cut, that's pain. If you break a bone, that could be described as acute pain. I've only had a fracture before, but I know that hurts. So if I'd have snapped that bone all the way through, I can imagine what that would have felt like. But chronic pain is if that acute pain lasts for longer than it should, and I believe it's about 3 weeks. Let's talk about those types of pain, and then what are the links between chronic pain and mental health?
Yeah, when I think about chronic pain, Michael, I think of something that usually longer than about 3 months, right? Like you said, if you could have an arm that you break or you roll your ankle, that's going to take some time to heal. When we talk about chronic pain, the way it can impact our mental health, we're thinking of those processes that are always there that we feel like we can't get around. So like the headaches, the back pain, the nerve pain, issues that last longer than just an accident, than an injury, and they're kind of always with us. Some people get arthritis in their knees. So those are kind of just what I think of as a chronic pain process.
Yeah. Interesting. Very interesting. What are the most common forms? Maybe this one you could start us out, Carter, of chronic pain. You mentioned arthritis. That's the one I'm familiar with. I've got a condition that was diagnosed 20 years ago with an injury in my foot, and it led to this. I didn't know what was going on, man. And every time I stepped on that right foot, I was getting this sharp pain, and I found out I've got osteoarthritis. So Let's talk about the most common forms of chronic pain. I later found out that it runs in my family. So my mother, my grandmother, my great-grandmother all had that same, and it was always in that foot joint. So it might be genetic with me, but talk about the most common forms of chronic pain that you've seen.
Yeah. I think that arthritis pain is a big one. Every joint that we have in our body has the potential to cause some sort of pain or grow into some more arthritis. The older that we get, the more that we use it. I think a lot of us walk around with headaches and we don't even realize it. We just think, we haven't had our coffee or we haven't had a good night of sleep, and we chalk it up to that. But headaches are a very common chronic pain predictor that a lot of people have. And then obviously the low back pain, sleeping wrong, and you wake up and it doesn't feel right. That's most of us. But for people living with chronic pain, that's an everyday ordeal, and that can be debilitating.
Wow. Christian, jump in here. I can understand the link between chronic pain. I understand that chronic pain can lead to depression, anxiety, and other mental health conditions like that. How can those mental health disorders feed into chronic pain? So I understand how you could start out with pain and you could get a little depressed about that. Can depression and anxiety lead to chronic pain? And if so, is it kind of cyclical? Can one lead to the other and then you're back to the first, and it's a never-ending cycle, so to speak?
Absolutely. They could be cyclical. The notion you're referring to is called psychogenic pain, actually. Wow. A person with psychogenic pain disorder will complain of pain that does not match their symptoms, or can't identify why the pain is occurring due to no physical acute injury. Some theories really suggest that it's due to pain memory, a condition that causes the nervous system to hold on to pain longer than an injury is healed. Let's use opiate use as an example. When opiates are taken as prescribed by a physician, opioids can temporarily reduce pain temporarily associated with surgery or any type of intense pain. However, when a patient decides to detox or wean off of the medication, withdrawal symptoms set in, right? And which include many physical symptoms such as body chills, aches, body aches, things of that sort. So more of the story is this: even though he or she may not have a physical knee injury or a muscle strain per se, since the brain, the receptors become agitated and confused during that withdrawal period, that malfunction causes a psychogenic pain disorder where there isn't a physical acute injury to that knee or muscle, but there's like a physiological and chemical imbalance causing those pain signals. So that's a good example of how, even though there may not be a physical injury, acute injury, psychologically and mentally, your body has taken that on as a form of pain.
Wow, it's just really fascinating to learn some of this stuff, y'all. Let me ask you about this. People who suffer from chronic pain are often unable to carry out daily functions. They previously had been no problem. I know for me, I used to be a runner, and I used to do 4 or 5 miles a day, no problem. Once that foot set in, I had to move to swimming or biking, something more low impact to kind of get me through it. As such, folks whose lifestyles have been sort of interrupted by that chronic pain, often they will suffer from anger, depression, anxiety, and the like. What are some of the most effective methods for treating that chronic pain so that folks never get to that second stage? So what's the best way to treat, or best ways to treat chronic pain?
Yeah, so I think some of the practices that are used with patients that I work with, it's really the education component, education and teaching the patient on their condition in depth, and provide resources and mental health chronic pain support groups. I think that's the initial challenge, because many of the patients have no idea or clue what's going on, or, again, did the chicken come first or the egg? So I think the education component is really key in providing those groups. Also, assessments and reassessments. So ensuring that you're providing those assessments and then reassessing within 3 to 6 months, or based on the need, or based on any type of crisis that may occur. Also ensuring the patient is seeing their primary care physician as well, or specialist regularly, and also in connecting with the mental health therapist. So that coordination of care is really important to make sure those two providers are talking to each other. That has been a challenge in the delivery health system currently, where those two systems may not talk to each other. And also reinforcing a culturally competent, holistic model in both practices, such as diet, exercise, what else? Effective self-care practices. And another one actually is also continual efforts with healthcare providers to pinpoint the source of pain, because a lot of times it's, again, right, it's cyclical. So is it psychological or is it physical? So you're constantly working with the healthcare provider to provide give them updates on what's going on with you, so they can really narrow down exactly where that source, that root cause is. And also ensuring a health equity lens is used when determining those causes. So you want to look and see if there's any cultural barriers that may be involved with that health plan that may not be identifying some of those issues that may be health equity related.